You may have read that Baystate Health has asked the state for $10 million in bridge funding to help them deal with a very complicated reimbursement problem on payments they get for treatment of some of their patients. Dr. Mark Keroack, the president and chief executive officer of Baystate Health, came in to explain this difficult situation and the possible actions needed if they don't get the requested state assistance.
It is an incredibly complicated situation, but here's the sort of short version of it. Baystate is the largest provider of services for the poor, for Medicaid patients in all of Western Mass, by at least a factor of 3 over the next largest provider. About 25% of our patients are paid for by the Medicaid program. And Medicaid underpays compared to Medicare, which is the program for seniors. They pay about 70 cents on the dollar, and so we lose 30% on just about all the services we give, and that amounts to about a $45 million hole that we have to dig out of. Now, the federal government and the state have recognized that being a heavy Medicaid provider causes losses to occur, and there are supplemental funds that are given out to large Medicaid providers, except for Baystate. And Baystate has been excluded from these supplemental funds for many, many years. We have been lobbying very hard with the legislature to get recognition of this. We think we may get some relief from the executive branch, from the Secretary for Health and Human Services, when they redo the Medicaid program in 2018, but that's still a ways away, and we're trying to see if we can plug that gap over the next year.
Let's put it in a little perspective, and please correct me as we go on this. Sure. But I mean, obviously, Baystate is a $2 billion plus annual operation, but $45 million a year when you are in that kind of hole before you open the door on January 1st, that adds up, and you've been eating this for a while. You can't go on forever.
Yeah, Baystate, when you add in our owned health plan, Health New England, we're about $2.5 billion. We employ 12,500 people. We're about 10% of the economy of Hampden County, so we're very, very big. But we're a very thin margin organization. If you look at, most of our profit comes at the big hospital, Baystate Medical Center in Springfield, which typically has a margin of about $70 million a year. The rest of the system, when you include the doctor groups, the smaller hospitals, the VNA, loses about $30 million, and so we net out to have a margin of about $40 or $50 million a year, which sounds like a lot of money, but it ends up being about 2 to 3 cents on the dollar. And we really need to have a little bit of a margin. We're a not-for-profit organization. We need to have a little margin to reinvest in our facilities, reinvest in our programs, build, replace stuff, that sort of thing.
Again, correct me if I don't understand or I misstate any of this, but for hospitals that do not get full reimbursement on Medicaid patients, normally turn to the privately insured patient, and a little more is charged there. That doesn't work for Baystate, if I understand it right, partially because you're not as big a system as, say, a Boston hospital that has a different kind of leverage, different kind of pressure they can work with the insurers. Now, correct what I haven't gotten quite right there.
Just a little bit off. I mean, it did work for years and years for Baystate. I think, in the years before health reform, we could reliably look at 3 or 4 or 5% rate increases each year from the commercial insurers like Blue Cross and Cigna, et cetera. Ever since health reform happened, those have been flat. So we've been effectively flat in terms of getting any increases from the commercial managed care providers for about 4 or 5 years now. In addition, the percentage of those payers has shrunk down so that right now 2/3 of our revenues come from governmental programs, Medicare and Medicaid. So flat reimbursement from the governmental payers, flat reimbursement from the commercial payers, but our expenses keep going up at about 3% per year or so. Both wages as well as drugs, devices, all the usual costs are going up. And so you do that math and it doesn't work. You can't just have 0 increases on your revenues and 3% increases on your expenses without getting into trouble eventually.
Let's talk about the impact that you have gone to the legislature, appeared before committees, explained to them what's going to happen. I know our local legislators who are in here regularly for different segments we do are all taking this very seriously, very concerned. You've told them, you've told everyone, a significant number of jobs may have to be lost. I think the number 200 in terms of jobs has been put around. I don't think, and correct me if you've spoken specifically about programs and areas, because obviously that causes a lot of difficulty for your employees. But what kind of impact, if you don't get something in the way of the $10 million you're looking for? The House put $1 million in. That's 1/10 of what you need and for help. But what kind of impact are we looking at?
So let me first acknowledge what you said,
Please.
and that is that we've gotten good support from the local delegation. Senator Rosenberg, Senator Lesser, Senator Welch have been fabulous for us. On the House side, Representative Swan, Representative Pupolo, Representative Wagner, really the Tosado, Gonzalez, the whole delegation has been behind us. The real sticking point has been that the budget in the House is very tightly controlled by the top officials who are all from the eastern part of the state and seem to be unmoved by these arguments. We have actually gotten some traction with the Secretary of Health and Human Services, who is willing to rewrite the rules and redesign the Medicaid program in which Baystate would be eligible for supplemental funding. In terms of what happens when we're under pressure for revenues, we've been under continuous pressure these last several years. Each year we try to do creative things and consolidate services, become more efficient. All in, over the last 5 years, we've identified $100 million in recurring savings by paying less for medications, by doing things across the system. And so we're going to continue to try to do that. For example, with the addition of Baystate Wing and Baystate Noble, we actually had 4 different VNA companies. And they were competing with each other, driving past each other. So we've brought them all together in a single company. That did result in some layoffs. It resulted in some efficiencies as well in terms of the way we spend money. So we're right now in the middle of those budget negotiations. We are not planning to get anything from the legislature. I mean, I'm going to keep my fingers crossed, but I'm not expecting anything good is going to happen. And there's going to be another hole we need to dig out of. And I'm going to go back to the same people who've been having very clever ideas on how to save money. Reducing programs and services that really make a difference to patients, laying people off is always a last resort. But the squeeze is very intense, and the hole's a very big one right now. And I think that if it were a level playing field, if everyone was playing by the same rules, I wouldn't be as upset as I am. But I really think that it's really a terrible injustice that's being done to the people of Western Massachusetts, that they are expected to do with less in terms of support from the state government than all the other providers of services for the poor.
Well, Dr. Mark Keroack, President, Chief Executive Officer, Baystate Health, thanks for coming in and really making this confusing situation a lot more understandable for us and our viewers.
My pleasure. Thanks for having me.